Okay, so today I'd like to talk to you about hospice and the nature of the industry of the hospice healthcare. My wow factor is a couple of days ago I was speaking with the COO of Solace Healthcare. His name is Justin Cheney. He stated that the state of Idaho is actually 10 years behind when it comes to hospice healthcare, and therefore only about 60% of the individuals who are eligible are actually on hospice programs. And that's something that really needs to change because there are a lot of benefits and a lot of programs implemented into hospice that can help individuals who are facing death. So I'd first like to discuss what hospice healthcare is. Basically, it's a palliative form of care that is designed to help individuals with terminal illnesses to help manage their pain. It's designed to try and increase their quality of life and also the quality of life for their family members and friends. It's one of the misconceptions that a lot of people have about hospice is that they believe that it's used to postpone death, where that is actually not the case. It's designed to not hasten nor to postpone death. They allow the individual to die at the rate that the illness is occurring in their body, and just give them the tools so that they can manage their pain a little bit better. Now, the reasons that hospices are needed are, first of all, when curative treatments are not working for a patient and their body is not responding, then they can switch to a hospice program, which, as I stated before, it helps them to focus on pain management with medication and also other therapeutic methods. The There's also emotional support that's provided directly from social workers, and it helps the family members to be there for them and also be provide spiritual support for them. There's also the spiritual support, but that is um, dependent on whether the patient and the family members would like that sort of support. Now, the individuals who are eligible for hospice healthcare are, first of all, you have to have a life expectancy of about 6 months, and you also have to be certified as a terminally ill patient, and have that referred from by a doctor. However, if family members see that an individual, their family member, or friend, or whoever, they see that they could possibly need hospice healthcare, they're not responding to treatments, then they can refer them to a hospice program, and then the doctor referral will come later. Last of all, the patient needs to agree to a palliative form of care rather than the aggressive treatment of the disease. And if after 6 months they are still alive, they can reapply and be recertified by a doctor as terminally ill and therefore continue on with hospice care. Now, the funding comes from several different sources. First of all, and obviously would be the private insurance. There's also Medicare and Medicaid, and sometimes the hospice that the individual is at provides payment programs that helps the cost to go down. And then there's also out of pocket from the patient and also the family. So with the private insurance, obviously, if you're paying for a policy that includes hospice healthcare, then you would be eligible. And then for Medicare, one of the interesting things about Medicare is that they pay for over 80% of all patients who are on hospice care. So that's one of the major sources of funding. And then Medicaid is the state form of Medicare, basically. Now, the benefits for being on hospice care are, besides the emotional and physical and spiritual aspects that we talked about, there's also a lot of volunteer work that goes on, and those volunteers go into the patient's home, and they allow the family members who are having to look over them to have some time for themselves and go out and do some shopping and whatever they need to do. It also gives individuals a peace of mind knowing that someone's there for them and helps them that kind of goes along with the emotional support that we were talking about. There's also a bereavement program that's typically in place that helps the family members and friends after their loved one has gone to talk about the scars and the stress that it has caused them, and to help overcome those barriers. Now, there's so many people that are involved with hospice, and they're all designated and put in place to help the individual and their families to have the best experience possible with such a terrible thing. So, in conclusion, I just like to I hope you have a better understanding of the importance of hospice care and what it can do for individuals, and hopefully in the future, if there is ever a need, you can approach the aspect of hospice with a more sound knowledge, and be able to allow the individual that you're concerned about to go into a program that would fit them best. Thank you for your time.